Welcome to This Week in Health IT News, where we take a look at the news which will impact health IT. This is another field report where we talk with leaders from health systems and organizations on the front lines. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. Are you ready for this? We're going to do something a little different for our Tuesday Newsday show next week. We're going to go live at noon Eastern, 9 a.m. Pacific. We will be live on our YouTube channel with myself, Drexta Ford, Sue Shade, and David Muntz with Starbridge Advisors to discuss the new normal for health IT. With you supplying the questions with live chat. Also, you can send in your questions ahead of time at hello@thisweekinhealthit.com. I'm so excited to do this, and I hope you will join us. Mark your calendar, noon Eastern, 9 a.m. Pacific on April 28th. If you want to send the questions, feel free to do that. And you can get to the show by going to thisweekhealth.com/live. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. They reached out to me to see how we might partner during this time, and that is how we've been able to support producing daily shows. Special thanks to Sirius for supporting the show's efforts during the crisis. Now, on to today's show. Today, we're going to talk about the CARES Act funding for telehealth with Eli Tarlow with Sirius Healthcare. And he is another person who holds the former CIO title. Good afternoon, Eli, and welcome back to the show.
Good afternoon, Bill. Thanks for having me again.
You seem well adjusted. You're making the transition to former CIO. Actually, Drexta Ford has taken the term recovering CIO and sort of patented it. So if you're going to use it, you have to give him royalties if you're going to do that, by the way.
I'm waiting for Drex to tell me what those 12 steps are.
There's a group of us. I'm excited about this conversation. You're going to give us some details. And, I'm going to start by referencing a story that I received in my email yesterday. And that was, it was on Christiana Care. Christiana Care has received $714,000 grant from the FCC to support telehealth services during the COVID-19 pandemic. They're one of only 17 health systems that have received that funding to date. But there's hundreds of millions of dollars available in this program. And we talked about this on our live show today, how important it is to find alternative funding sources for IT, because this is going to be a very challenging time. So we're going to go into the details. You're going to help us to really understand this program. So with just that as the setup, what is the program and how much is available?
Sure. Thanks, Bill. So before we talk specifically about this program, the CARES and the Telehealth Program, just to give some perspective, perhaps. So this is actually the third stimulus bill. The first one, as many know, is what was called the Coronavirus Preparedness and Response Supplemental Appropriation Act. And that funding, that bill, which came out towards the end of February, approved, was primarily focused on vaccination developments, research, masks and other PPE for the healthcare agents needed for treating patients. Some of it was for loan subsidies for small business, et cetera. So that was kind of the first push, or the first bill that came out. That was about $8.3 billion. The second bill that was approved and announced was what they call the Families First Coronavirus Response Act. And that was, as many know, it was focused on unemployment insurance for laid off employees, free coronavirus testing for those that could not afford to pay, food assistance for children, et cetera. And so now the third one we're talking about is the specific to telehealth as part of the third stimulus bill, which has been nicknamed CARES, which stands for the Coronavirus Aid, Relief, and Economic Security Act. So that bill was passed on March 27th for roughly $2 trillion, obviously the largest one to date. 7 main groups, and I won't go into all of them. The one specific that we're going to focus on is hospitals, public health, et cetera, and more specifically is telehealth. The amount that was approved for telehealth in this part is for $200 million.
Wow, $200 million. So who's eligible and how much can I apply for? Is it based on the size of my health system? How much can each award be?
Sure. So the program is actually eligible. It's open to eligible healthcare providers, obviously, that treat patients And it doesn't matter if they're located in rural and non-rural areas, U.S. territories, et cetera. There's a limit of $1 million per organization. That's the limit of $1 million funded that can be awarded to any individual organization. It's for post-secondary educational institutions, it's for community health centers, it's for local health departments or agencies, community mental health centers, not-for-profit hospitals. There's 8 different areas that make an organization approved for that funding.
So actually, we could go into what are those 8 areas, but we could also just go into, what does the money have to be used for in order for me to be eligible to get this money?
Excellent question. So this telehealth program, this COVID-19 telehealth program funding is to provide eligible healthcare providers to support the purchase of telecommunication, IT systems, connected devices that provide telehealth service to patients in response, obviously, to coronavirus. So it could be anything from devices like pulse oximetry, blood pressure monitoring, devices that themselves are connected. It won't fund unconnected devices that patients could perhaps use at home and then manually report the results to their medical professional. So it's connected devices could include devices that are Bluetooth or Wi-Fi kind of capable.
Interesting. So, yeah, and people need to know that. I mean, this is through the FCC, which I guess makes sense, right? So we're talking about real-time monitoring types of devices. We used to do home health, and we had devices that were connected up to an iPad, which was connected up to something else. Those kinds of devices may not be eligible for this, but the real-time monitoring stuff, the things that you would connect up to Wi-Fi or connect up to a cell network, a mobile network, and communicate that stuff back, those things are eligible?
Yeah, let me give you some advice, some examples, because it's really broad in the way I interpreted it. It could be telecom services, broadband community connectivity services. So it could be actual voice services that organizations turned on to do this. So it could actually be telehealth through voice. It could be tablets, smartphones, the procurement of those devices to support the practice, if you will, of telehealth. I mentioned some of those kind of pseudo-biomed, pulse oximetry. It could be platforms, the ability to transfer images for patients. So the mind can really wander in many places, but just as you mentioned, it seems to focus specifically on connected devices and not devices that maybe you would dock and upload.
Wow, not to take us too far off, because I really want to transition this and talk to you about the future of telehealth with with the closing minutes we have here. But I could almost read this and say, hey, we need to upgrade our phone system. We're going to do telehealth through our phone system. I'm going to take that $1 million and I'm going to purchase a Cisco platform to upgrade our call center.
Yeah, I mean, if you're looking to purchase a new phone system for a hospital, and by the way, we'll get telehealth out of it. Yeah, I don't think the funding won't provide for a new phone system. But if you can focus in on the value of the telecom to promote telehealth, then that particular aspect, I would imagine, is eligible.
So the spirit is to promote, to really sustain the gains that we've experienced over the last couple of months in terms of really increasing access, improving the reach into the community, keeping people in COVID safe, non-COVID environments for care. It's really expanding all the things that we've experienced over the last 8 weeks or so, I would imagine.
Yeah, and Bill, maybe I'll give a couple of examples of examples that where organizations have already been received approved funding. There's one, without naming names, there's an organization in Georgia that received about $750,000 to implement telehealth video visits, virtual check-ins, to do remote patient monitoring. So that was a very large award, or I should say a large proposal. It included, and really it was about reducing, for that aspect, it was about reducing PPE during this epidemic. So that was kind of the spirit, is how do we look at telehealth, how do we look at technology options. And then I'll take you to a whole other end of the spectrum, where there was another organization in Pennsylvania that was awarded a couple $100,000 to provide telehealth services to children who receive organ transplants and are immune compromised and at high risk for COVID-19. So you can see that it's really, really large, perhaps in variety, but always comes down to how does this really promote telehealth?
Absolutely. All right, so let's transition with the tail end of this. Seema Verma over the weekend said, I think the genie's out of the bottle on this one. And Seema Verma is the CMS administrator. She said, I think it's fair to say that the advent of telehealth has just completely accelerated, and that it's taken this crisis to push us to a new frontier, but there's absolutely no going back. So that's what Seema Verma with CMS is saying. Eli, so I turn to you and say, do you think this is going to be the tipping point for virtual care in our industry?
Absolutely. You just can't take, well, for starters, you can't take back what we've already done. I think the adoption has gone so far that physicians, providers, organizations are not willing to give back what they've already implemented. Number one. Number two, there was actually a survey that was done recently, a survey of 800 physicians, and 60% of them not seeing COVID patients today were willing to move ahead just based on the advancements specific to COVID. And this was a survey done by general medicine practitioners, subspecialties, surgeons. That's people that haven't even begun using telehealth to promote, to help with COVID-19, and they're all on board. And if we just take a step back to maybe why we're now talking about telehealth so much more than we have, maybe 5 years ago. And maybe I look at it and say, okay, what are the three areas that need to really happen to make telehealth work? Now, the first one is obviously the capability, right? You have to have the ability to do something distant that perhaps we historically did face to face. And there's easy ones, the less complicated ones like behavioral health, right, where you don't have to actually necessarily touch the patient. It's facial expressions that maybe you need to see remotely, or body language. But telehealth is very relatively easy in behavioral health situations, and that's how that was an early adopter of telehealth. Then we went on to e-visits in emergency department. Are there ways that we can kind of have the emergency department visit distant, I call, rather than remote? So I look at it as three aspects, and we go along as we move along in this journey. There are really three aspects to consider. The first one is the obvious one: is it possible? Can we provide the same or better level of care from a distance? And then there are things that will be a lot easier to do, and there are things that will be a little more complicated to do. I mean, to surgery, to deliver a baby. These are things that are very, very difficult to do with telehealth. Things that have less touch are more obvious. So the first one is, is it possible? Does that capability exist? The second one is there an interest, right? So we talk about the quadruple aim, and physician burnout is a big one. Does this increase their burnout, or perhaps does it decrease their burnout? There's a big school of thought that says, well, if I can now do things from home and I don't have to go into the organization, well, that makes my life easier. Well, look what happened when we went from real, landline phones to cell phones. I don't know, there's an argument to be made either way if our life got easier or more difficult now that we're always available. And then the third one, and this is really important, is does the reimbursement model exist? So you can have the technology, you can have the willingness, but one of the biggest things that happened recently with the stimulus bill, with these, the barriers that were really broken down, was that CMS has now agreed to fund telehealth. And so I see that growing and growing and growing. And I just want to mention one other thing related to that, is that now this Congress is considering another bill called the Emergency COVID-19 Telehealth Response Act, which will expand telehealth, Medicaid and Medicare reimbursement for physical therapists, occupational therapists, social workers, speech therapists, audiologists. So just try to imagine someone with ALS at home who now has access to therapy reimbursed by CMS through telehealth. So, I mean, I obviously I'm excited about this. I think this is perfectly aligned with the quadruple aim: reduce cost, patient care, patient experience, physician engagement. The world is flat, and the last thought on that is that we're entering a generation of millennials that live by doing things distantly. I mean, I think it just speaks to the future.
Yeah, it is really exciting. And I think some of the possibilities we haven't even thought of yet. I interviewed somebody on the show, and they said you come into their emergency department, and if you don't really want to wait in the line, there's actually telehealth to the left. It's like go to the right and wait in the emergency room, go to the left and actually do telehealth. And they weren't sure how it was going to go. And it went gangbusters because people were like, yeah, I'll try it. I mean, if it's going to reduce my wait by 45 minutes, I'll try it. And it was really kind of interesting when we were talking about it. The number of people who went through it, experienced it, the cost was lower. They in some cases didn't need any emergency visit whatsoever. They were able to see a primary care physician later, and it relieved the burden on the emergency department, and it just created a new experience for this for the patient population. There are so many untapped areas at this point. I did want to close this up by saying, how hard is this to do? I mean, is there do I have to write a grant proposal and get grant writers and those kind of things, or is it there's a website to hit and a form and that kind of stuff? Because some of these grants have come out pretty quick.
Yeah, first of all, it's not difficult. Unfortunately it's not an online form. It's a PDF. It's something to be completed. It's not a difficult process. My colleagues and I can help those that find it challenging. 2 points to make about that. The first one is very important. It's not necessarily only things that organizations are considering in the future. So any device, any eligible service that's been purchased on or after March 13th, this past March 13th, 2020, is eligible. So if organizations just leaped into action, purchased iPads, purchased different things for telehealth in response to COVID, then they should come up with that list and seek reimbursement for that. The second important note on that is that it's on a first come, first served basis. So once this $200 million is exhausted, then the funding won't be available. No deadline has been set for filling this out. To apply, the FCC has a site. It's a little lengthy. I'll just read it out. It's fcc.gov/COVID-19-telehealth-program. There's a great FAQ section. And like I said, myself, my colleagues can help others out if they find the need.
Fantastic. There's also a Sirius link. It's a pretty lengthy link. So what I'm going to do is I'm going to do a redirect. You can hit thisweekhealth.com/Sirius, SIRIUS/telehealth, and it will redirect you over to the Sirius site. They have a bunch of information for you on that, ways to get in touch with them, ways that they can help you through the process. Eli, always a pleasure to sit down with you. Thanks for filling us in on this really exciting program.
Excellent. Thank you, Bill. I appreciate the time.
That's all for this week. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, Sirius Healthcare, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send them an email, DM them, whatever you do, however you do it. Go ahead and do that, and that would benefit us greatly. We appreciate your support. Please check back often as we will continue to drop shows until we get through this pandemic together. Thanks for listening. That's all for now.